All right, so the last session of today, well, the last formal session of today at least. What we're going to do is everyone's back online, so hopefully we'll still have all of the hubs and hopefully everybody can see us and hear us. And throughout the course of today, I think it's become very obvious what the common theme is. It's the people of COG, it's the people who have done well, the people who pulled together. And so we've got a little session called Unsung Hero Awards, which is basically we've asked people to put nominations of their colleagues and peers, people who have worked hard and made a difference. And we're now going to read it all out for you guys. So, there we go. All right. On Your Tool and Verity Hill, both PhD students have built tools and resources that are being actively used the world over for public health. They have had phenomenal real-world impact and worked tirelessly over the pandemic.
Anna Philippe. Anna is a formidable scientist and technically brilliant at all next-gen sequencing challenges. She always rises to the moment, creating excitement and enthusiasm all around her, from sequencing Ebola to SARS-CoV-2. She runs our genomics team like clockwork, and I hope she never leaves us.
Angela Beckett. I think we heard this story today, but just to reiterate, Angie joined my group as a specialist technician on the first day of lockdown, which was pretty inauspicious way to start a new role. In our induction meeting, I briefly mentioned that I was trying to do some work looking at nanopore sequencing of SARS-CoV-2 from COVID-19 at our local hospital and asked if she would like to be involved. Since then, Angie has been absolutely instrumental in the ability of Portsmouth Lab to scale up for high throughput sequencing as a member of the COG-UK Consortium. She optimized all of our processes, set up new equipment in the lab, train new staff members, and ultimately ensure that the scale up to national levels was achievable. She has proven herself to be an amazing researcher under incredibly difficult conditions, and I hope that she is immensely proud of what she's achieved.
I can't remember whether I gave you all the long ones to read or not.
No, I shortened mine.
So the next nomination is for a team. It's Anthony Underwood, Khalil Abudahab. Sorry, we should have warned everyone at the beginning that we're not brilliant on pronunciation. So if I mangled your name, Khalil, I do apologize. Ben Taylor and Corey Needs. This team maintained and built data platforms for fundamental data entry into Colquhoun, which have had a profound impact on the ease of data entry into Majora. They also maintain and produce the COG microreact, which has been used globally as a route to delivering COG data for the public and for scientific communities.
Yes, a disclaimer should have been said. Names are hard and we apologize. Beth Blane. Beth has coordinated and adapted plans for the delivery of thousands of samples all around the UK with varying levels of information, assistance, and cooperation. She had been key to the success of all downstream sequencing activity and has done it all with the best of attitudes while working on a master's and assisting with the University of Cambridge students' sequencing efforts. So Beth actually had 2 nominations. And Beth was central to the logistics team, and her efforts are vital in ensuring that samples flowed from hospital microbiology labs to sequencing sites, as well as many other responsibilities.
Sharon Glaysher. Dr. Glaysher is the lab manager in the Translational Research Laboratory at our local NHS Trust, and I have had an excellent and productive research collaboration with her for several years. When lockdown first hit in March 2020 and the university lab closed, I called her and asked if I could leave some equipment in her lab. I wanted to make sure that we had the option. I wanted to make sure that we had the option of doing some work to help the hospital track COVID spread And we worked quickly to arrange some startup funding and obtain research ethics for the project. Little did we know that this would eventually lead to processing more than 800 samples per week as part of COG-UK, including the week before Christmas when she processed more samples on her own than the rest of the lab ever managed in a single week. Our ability to participate in COG-UK Consortium was only possible due to the accommodation that Dr. Glaysher and indeed the entire Portsmouth Hospital University NHS Trust afforded us throughout the pandemic, and her hard work and leadership throughout this time.
Kate Twing. The data linkage development of PHE and the early outbreak investigation using COG samples was only possible thanks to Kate's incredible technical skills, fantastic overview of all the data systems involved, and her tireless enthusiasm and eye for detail. COG has come a long way since those early days, but her ongoing contribution has been vital from the beginning.
Katerina Galai. Katerina has been instrumental in the business management of COG-UK. As an associate director, she has taken responsibility for supporting governance, legal, financial and management aspects of COG-UK and so much more.
Kim Smith. Thanks to Kim's hard work and determination, all COG partners have been chased for invoices and paid. No small task when it comes to 20 partners and never quite matching numbers of sequencing. Thank you, Kim, you've been a star.
Matthew Parker. Dr. Parker has been instrumental in designing and deploying the laboratory LIMS pipelines and Arctic bioinformatics pipelines for generating thousands of SARS-CoV-2 sequences from the Sheffield, Yorkshire sites. He has devoted many nights and weekends on tracking variants of interest at our hospital trusts and has contributed several high-profile COG papers on the dominant strains. This work was a transition from his postdoctoral research on neurodegenerative disease, and the sacrifices he made for COG-UK limited his research output in neuroscience and prevented his promotion to PI. I believe he has no regrets, and as his line manager in neuroscience, I am proud of what he has contributed.
Patrick McClure. Patrick coordinated sample delivery, sequencing and extraction pretty much single-handedly without taking any time off for 11 months during a global pandemic and ran a smooth pipeline leading to sequencing of over 5,000 samples. That sounds pretty heroic to me. I would agree.
Paul Bird. Paul represents the multitude of diagnostic laboratory professionals who have been crucial to the success of COG-UK by ensuring the supply of samples to the sequencing labs. Paul and individuals like him in other labs have identified, located, aliquoted, packaged and sent samples to the sequencing labs with minimal fuss and for no or limited personal or professional recognition. Like the man sweeping the floor at Cape Canaveral, the success of large projects like COG-UK are reliant on the contribution of every individual.
Rachel Colquhoun and Ben Jackson. Between them, they created the phylogenetic and data processing pipeline on Climb and maintained fixed and developed it at scale of data got even larger. The output of this pipeline was relied on by all of the PHAs and others for local investigations and analysis. In particular, the widely used Civet tool was built on the output of this pipeline. The microreact phylogenetic dashboard was also used this output.
Another nomination for Rachel Colquhoun. So Rachel is postdoctoral researcher in Andrew Rambo's group at the University of Edinburgh. She has worked behind the scenes on COG-UK data pipe and filer pipe, on which everyone downstream relies. She has worked on software tools such as Scorpio and Pangolin, has always been willing to jump in to help and share her expertise. She's very giving of her time at all hours and contributes so much to the lab and COG-UK as a whole. Somehow, while also juggling a newborn baby in the middle of a pandemic. She really is a true unsung hero of COG-UK. There was a third nomination, which I'll now read out, for keeping the data pipes running smoothly and reacting quickly to any and all issues that occur with them.
Radoslav Poplawski. Radoslav has been instrumental in keeping the COG-UK computing infrastructure running. Without this, data could not be processed. He has considerable expertise in computing and has been an extremely valuable asset to COG-UK.
Stephen Liggett. Sorry, really small text on this one. Remind me to put a character limit next time we ask for unsung hero nominations. From the onset of the COVID pandemic, Stephen has been an enthusiastic advocate of sample testing in our hospital to support both research and tracking of disease spread in his role as the Path Lab manager for testing. He does not find public speaking easy, being naturally reserved and self-effacing, but he has raised the profile of COG-UK by presenting on numerous occasions to support the importance of testing. He has always supported ITU in our requests for answers with immediate and enthusiastic responses. We are all in some degree foot soldiers in this pandemic, but without people like Stephen, we would not have the depth and breadth of data that we have. Stephen also has another nomination. That said, Stephen fought to begin sending COG samples for sequencing at Northumbria University when others didn't see the benefit of doing so. He liaised with the virology department at JCUH and put in place a standard operating procedure to make the process as effective as possible.
This one is for the COG-UK team. It would be invidious to pick out individuals. They're all exceptional, always helpful, pleasant, patient, and hardworking. Without them, COG would not be what it is.
Verity Hill. Verity wrote the scripts for all the geography cleaning for the analysis pipeline on Climb. This included handling the existence of multiple incompatible ways of dividing up the country, as well as the wonderful world of things people put in their metadata and missing data. As a result, it required many, many hours of manual curation, which is probably invisible to most users.
Yasmin Chaudhry, in the past year and a half, Yasmin has been the linchpin of our sequencing efforts in Cambridge, coordinating and participating in sample retrieval, RNA extractions, and library preps with thousands of samples from different sites. A lot of our achievements can be directly traced to her extraordinary dedication to the work and incredible ability to inspire the rest of us.
Natalie Sparks. Working under the supervision of Dr. Josh Quick, Natalie has been key to a lot of milestone achievements. She carried out the majority of the testing of version 3 and version 4 primers for the Arctic SARS-CoV-2 kit and helped carry out library preparation and sequencing of numerous COVID-19 genomes, especially during the winter when Alpha came to prominence. Moreover, she has been excellent at teaching new members of our lab how to carry out genome sequencing with nanopore technology, as well as many other applications.
Will Hamilton. Will has been instrumental in setting up the workflow for identifying samples for sequencing and collecting the metadata, working closely with the PhD lab team, the university sequencing team, and the Sanger team to ensure the seamless flow and processing of samples and data. We'll also conduct a combined genomic and epidemiological data analyses in real time and has trained a number of clinical and lab staff in bioinformatic analysis and has led or co-authored a number of publications arising from this work. He truly is an unsung hero of COG-UK and richly deserves this recognition.
Andrew Sparks. Andrew has played an integral role within Sanger software development, designing and implementing the cherry-picking logic behind the Beckman and Biosero systems. These systems have enabled Sanger's pipeline capacity to increase to 64,000 samples per week, an unprecedented figure. The success of these projects can be contributed to Andrew's skills and dedication, and he deserves to be recognised for his considerable contribution to COG-UK. And another nomination for Andrew says, Andrew has been invaluable in designing and implementing the high throughput integrated cherry picking systems of Sanger, sequencing COVID-19 at a scale that would not have been achieved within the challenging deadline without him.
Sam Nicholls. Sam is Climb/Majora, and he has kept the show on the road for all of us. The consortium could not have functioned without this central piece of computing infrastructure, and Sam made it happen. He has also been amazingly responsive and supportive to all of us, despite his insane workload. I couldn't have done my work without Sam, and it would have been a lot less fun. Give the man a pay rise, or at least a PDF of an award with some stock photos on it. I'm not sure if this is a message from Nick Lohman or for Nick Lohman, but we're just going to, Nick, I hope you're there and I hope you're listening. Sam got another nomination. Sam has worked tirelessly to design and maintain the Majora. Without Sam, it is difficult to imagine that COG-UK would have been such a success. Lastly, I do not believe that Sam has received enough credit for his work.
Sam Nicholls and supporting team members. Bringing up the COG-UK data tracking and processing hub from nothing. Wow, I salute you.
Siona Silveira, Sarah Jeremiah, Helen Appleby, and Stephen Applin. Siona, who was instrumental in setting up the system from transporting the samples from us in Southampton to sequencing in Portsmouth, as well as re-extracting all the samples that went through COG-UK study. She was employed specifically for this as a Bound for scientist. She learned everything very quickly and did a great job without a fuss. We since kept her in our department and hopefully she will progress further in her career. Sarah Jeremiah, an infection control nurse, Dr. Helen Appleby and Mr. Stephen Applin, who are part of the infection control team, tirelessly worked through the CRFs despite the busy day-to-day work in the infection control. Without their collective and teamwork, we wouldn't have been able to complete the study. We're halfway through.
We'll start talking quickly. Bart Siwek. Bart is very dedicated and does everything he can to be as efficient as possible. He destroyed millions of samples, shipped hundreds of thousands of samples to other sequencing centres, and is responsible for receiving and portering all plates at Sanger. Bart goes above and beyond, and we are very lucky to have him on the team. The second nomination for Bart says, Bart, together with his team, have coordinated sample portering, storage and destruction in excess of 20 million samples at Sanger since the start of COVID-19 sequencing initiative. It has involved working in temporary -20 cold structures on a daily basis. The cold stores are located outside, and Bart has had to work within these facilities in all weather conditions to ensure sufficient storage is maintained through regular destruction cycles, no matter what the conditions. Bart's tackled this work with enthusiasm, professionalism, and has been tremendously supportive to the laboratory teams, identifying further ways further ways to support the laboratory operations by taking on additional tasks so the teams can focus on sample processing. Bart's activities have been a vital part of enabling us to scale up our operations. He's been a pleasure to work with, and his ongoing support is greatly appreciated.
Alex Trotter. Alex is a Quadram Institute bioscience researcher working on SARS-CoV-2 genomic epidemiology with COG-UK. He's the most wonderful, dedicated and hardworking individual who has worked tirelessly throughout the pandemic, supervising and undertaking high-quality sequencing of thousands of samples of Pillar 1, Pillar 2 and overseas service users, either with an extremely small team or entirely on his own. Alex has worked extremely long hours to provide this service whilst completing his own PhD thesis and continued to offer support and advice to colleagues together with valuable sequencing data whenever requested. No request for assistance has ever been too much trouble.
Tanya Brooklyn. Tanya's been the driving force behind the Wellcome Sanger Institute's efforts since day one. She took on the impossible task of managing every single aspect of Project Heron and has somehow kept us all on track throughout the project, while also keeping a bright outlook. This ever-expanding project would have likely deflated after the initial push without her positive force and still keeping us organised and motivated.
David Studholme. David responded to the pandemic equally to his NHS colleagues, working long days and out of hours to help provide rapid analysis of sequencing data. He appreciated the value of these data in outbreak management and is yet so modest, few would know of his contribution.
George McIntyre-Cockett. Throughout 2020 and early 2021, George was the only technician processing samples in Oxford using a bait enrichment protocol he developed, and the only example of non-amplicon method used at high throughput during the pandemic. He scaled up processing tenfold to meet demands for COG, non-COG studies, and lighthouse surge sequencing, and has processed over 30,000 samples single-handedly. He can operate 4 96-channel pipettes simultaneously with video evidence to prove it. We should have got that video. Over Christmas 2020, he processed 1,500 of the first Oxford vaccine and ONS samples at the beginning of the alpha wave. He is his own lab manager and still finds time to develop his systems for pandemic preparedness, other pathogens, and to sequencing and to other sequencing platforms, such as novel SARS-CoV-2 PacBio protocol currently being used to understand between host evolutionary bottlenecks.
Sarah Buchan. Sarah was really the key member of the team here. She set the whole system up for us and worked tirelessly despite having her full-time teaching commitments off-site to make sure all the samples and data flowed seamlessly. We would not have been able to consider joining COG without her.
The PenGU IP5 team, consisting of Georgia Pugh, Jessica Powell, and Tara Annette. This team of 3 joined us in February 2021 to man the IPS Public Health Wales Surge Laboratory, which is located adjacent to the Welsh Lighthouse Laboratory. The remit for this team was to cherry pick the Pillar 2 samples from the extract plates received from the Lighthouse Laboratory. The team are from varying backgrounds, none of which are diagnostic laboratories, so they were inexperienced and having to learn in a very high-pressured environment. They hit the ground running. Their professionalism, work quality, and accuracy has been exemplary. Prior to the team starting the sequencing rate for Welsh Pillar 2 samples was between 0.3 to 5%. After they started, the coverage jumped to 20.5%. And once they felt their feet, it went up to 40%. As we are unable to differentiate between those that are Welsh samples and those that are samples from the rest of the UK at the point of cherry picking, they have been helping in the overall UK sequencing coverage of Pillar 2 samples as well.
Another one for the team. So this is for Brie, Gattaca Wilcox, Sarah Summerhays, Alec Birchley, Leah Graham, Jason Coombs, Harry Williams, Jessica Hay, and Alexander Adams. At the height of the pandemic, this team was sequencing 6,000 COVID positives per week manually. As automation wasn't quick enough to have acceptable turnaround times for variant tracking, not only did they achieve this, they also delivered the routine services and continued to learn new techniques. This team is truly remarkable and a credit to Public Health Wales and the Pathogen Genomics Unit.
Jason Coombs. As a member of the PenGU lab team, whose workload was already pressured, he managed and juggled reagents to ensure all sequencing services continued unimpeded during the pandemic. He was reactive to changes, of which there were many. He also put in many hours of overtime and weekend working to ensure the PenGU ship kept sailing.
Scott Goodwin. At Sanger, we order our own individuals oligosynthesis for Arctic PCR. Scott has rebalanced both Arctic V3 and now V4 pools for even genome coverage and to reduce the incidence of dropouts. He has single-handedly generated outputs of these over the last 18 months, enabling targeted amplification of over 1 million samples.
A nice short one. Fiona Rogan, for keeping things going on a practical level in the lab while also dealing with a battery of administrative and organizational tasks.
That sounds like a lot, though.
Yeah.
Sophie Palmer. Sophie was critical in the first months of COG-UK, sorting budgets, helping prepare the funding application, and generally being fantastic organizationally. Quite simply, she was a critical part of COG in the early stages.
Gordon Dugan. Gordon provided sage advice and guidance to the COG steering group and management from day one of COG-UK. He was instrumental in the early setup of COG and later convened and chaired the COG-UK governance and advisory group.
Tanya Brooklyn. Tanya installed our whole bin feed pipeline from the ground up in record time, giving up weekends and nights. He kept himself available 24/7 for any regular and bespoke analysis on top of his usual responsibilities and probably sacrificing family time in the process.
Rhona Long. Without Rhona's tremendous, sorry, it's a long one as well. Without Rhona's tremendous work as a category buyer and Sanga's procurement team, we would not have been able to scale the sequencing operations and sequence as many genomes as we have. The global supply chain has been incredibly strained with extreme pressure placed upon the supply of laboratory hardware. Tips for liquid handling, robotics and PCR plates to name just a few. To the excellent work relationships that Rhona has built with key suppliers, we have been able to not only continue sequencing throughout but vastly increase the volume of samples processed. Rhona's worked tirelessly liaising with suppliers in different time zones, out of hours and at weekends to ensure that we can source the required materials and identify alternatives. Rhona and colleagues' work has been every bit as important and at times even more challenging than the sequencing work itself, and we're all very grateful for all of her great work to ensure that we have the materials needed to continue sequencing.
Beatrix Kele. Beatrix has worked really hard on implementing the sequencing of SARS-CoV-2 at Bart's Health in most difficult of circumstances with very little resources and very little staff. She has also been keen on participating in all the challenges that have come our way with great energy and enthusiasm, be it Hoki, Genomic, COG-Train, and even helping out overseas teams that are trying to implement SARS-CoV-2 sequencing. My respect to Beatrix.
Aminu Jahan. Aminu is a medical doctor from Nigeria who has been trained in molecular virology during his PhD at Cambridge. After key members of staff left Cambridge, he had a significant gap in expertise. We had a significant gap in expertise, sorry, Aminu. Our lab is not a sequencing facility and therefore we had to draw on existing expertise. Aminu learned basic bioinformatics to allow us to assemble sequences locally and to push the data and associated metadata to client. Despite having no command line use or bioinformatics experience, he picked this up quickly. He also worked with local colleagues to write R scripts to ensure that metadata is collected from the local medical informatics system and converted into a suitable format. Aminu has worked tirelessly and always ensured that genome assembly and metadata collection is done in a timely manner.
Marc Fuchs. Marc is a technician in our small genomics lab in Queen's University Belfast, and he has implemented the COVID-19 surveillance program for large-scale rapid whole genome sequencing for Pillar 2 cases across Northern Ireland, including workflow implementation, consumable resource and lab training and scheduling, risk assessment and implementing a safe COVID environment for staff.
Georgie McManus. Georgie heroically battled through endless media requests over the winter months and delivered an amazing new COG-UK website.
Andy Jermy. Andy's resourcefulness, quality and hard work have been inspirational from the very early days of COG working on SAGE reports and running internal seminars and analysis meetings through to this day supporting comms and being an integral part of the team. Andy always comes from a place of yes and is great in a crisis.
Ellie Brooks. Thanks to Ellie, COG-UK mailing lists, meetings, agendas and minutes are organised and accessible. Thank you for bringing order to the chaos and being such a great team player.
Carol Churcher. Carol is a hero because despite only working 2 days a week, you will somehow always get an immediate reply from her on any given day. Thank you, Carol, for working your magic behind the scenes and ensuring that all administrative questions are always answered. Also, Carol helped put together COG budget and supported the recruitment of everyone in the central team.
That's it.
I think now we clap.